Atorvastatin, one of the most prescribed drugs worldwide. It can drastically reduce your risk of heart attack and stroke, but at the same time, it has sparked debates in many countries regarding diabetes and maximum dosage and has even been withdrawn from the market. That's why today we're going to talk about atorvastatin. What is it? How does it work in the body? What effects does it have? Are they good? Bad? Are there any side effects from taking this drug? What are the contraindications? How does it interact with people who have diabetes or obesity? What are the main interactions that atorvastatin has with other drugs? We'll also mention the correct way to take atorvastatin. So stay until the end of the video and find out all this and more. We are the Gamed Project. Let's begin. Let's start by defining what atorvastatin is. Atorvastatin is a medication from the statin family whose main action is to reduce bad cholesterol, which refers to LDL, low-density lipoproteins. By reducing this type of cholesterol in the blood, we also decrease the risk of cardiovascular events such as heart attacks and strokes, generally in patients at increased risk. Now, you might be wondering, what is atorvastatin used for? What are its main indications? Firstly, for those undergoing treatment for hypercholesterolemia, atorvastatin is very helpful, since hypercholesterolemia refers to a disorder in which the body has high cholesterol levels, and therefore, atorvastatin is responsible for reducing these blood cholesterol levels and also triglycerides. You have to keep in mind that there are two types of cholesterol in your body: LDL, which is the bad cholesterol, and HDL, which is the good cholesterol. Okay, LDL stands for low-density lipoproteins, and HDL stands for high-density lipoproteins. By taking atorvastatin, you're lowering LDL, which is the bad cholesterol. Pay close attention to this. We also have to consider that atorvastatin will greatly help reduce the risk of heart attacks, strokes, and revascularization in patients with cardiovascular disease or those at high risk. It will also be very helpful in managing mixed dyslipidemias and high triglyceride levels when combined with diet. This is very important when taking atorvastatin. What effects will atorvastatin have on the body when I take it? The first is that it will block cholesterol production in the body by blocking the enzyme 3-hydroxymethyl-gluteryl coenzyme A reductase. By reducing this enzyme, it will limit the liver's synthesis of cholesterol. This increases the uptake of LDL, which is the bad cholesterol, by the liver and will reduce circulating levels. It will also have a clinical effect that refers to a sustained decrease in LDL. The long-term reduction in atherosclerotic plaque formation and the lower incidence of heart attacks or strokes can lead to a lower risk of stroke. What is the recommended dose of atorvastatin? The typical starting dose is 10 to 20 mg per day. People who need a more significant reduction in LDL cholesterol can start with 40 mg or increase to 80 mg, depending on their goal or the dose recommended by their doctor. Remember that you should never self-medicate with any drug. Also, keep in mind that atorvastatin should be taken once a day, as it has a relatively long half-life, so you can take it in the morning or at night, as long as you are consistent. Note that you should not combine this medication with any citrus juice, such as orange or grapefruit, as atorvastatin will interact with citrus fruits. Now, what are the most common and uncommon side effects? Well, there are common side effects, or these are also called minor side effects. The person may experience mild muscle discomfort. Headache, nausea, constipation, or diarrhea may occur. In a small percentage of cases, there may be a transient elevation of liver transaminases. There are also rare but serious side effects, such as myositis and rhabdomyolysis, which refers to muscle breakdown with kidney risk. This is more likely if there are drug interactions or risk factors such as advanced age or kidney failure, or if it is combined with other medications while taking atorvastatin. What are the most important contraindications and precautions to consider when taking atorvastatin? The absolute contraindication is if you develop a hypersensitivity to atorvastatin. If this occurs, I advise you to stop taking it and consult your doctor again to determine why this is happening and what alternative medication you can be prescribed. We also need to understand that liver disease active or unexplained persistent elevations in transaminases may be a contraindication to atorvastatin use. What about during pregnancy and breastfeeding? Statins have been shown to potentially harm the fetus. Precautions: we must consider that transaminase levels should be monitored in individuals taking atorvastatin before and during treatment if there are common risk factors. We must also consider that if severe muscle pain occurs, we should investigate potential interactions, such as whether the individual is taking other medications besides atorvastatin, such as antifungals, aspirin, macrolides, or protease inhibitors, which increase the risk of myopathy. Another very important point to mention is the relationship or effect that statins, the class to which atorvastatin belongs, have on individuals with diabetes and obesity. If we're talking about diabetes, let me tell you that if you're a person with a pre-existing diabetes diagnosis or who has a high cardiovascular risk, taking statins will reduce it. Statins significantly reduce the risk of heart attack and stroke. Obesity alone is not a contraindication for statins. Many obese patients will benefit considerably because LDL cholesterol will be significantly reduced. Cardiovascular risk will decrease, and there may be increased monitoring due to the elevated risk of diabetes and metabolic syndrome in obese individuals. This is why weight control, dietary management, and exercise are essential, as they are complementary pillars. This information is very important to keep in mind, as it explains why atorvastatin should be taken and what it is used for. What is the correct way to take atorvastatin? It is taken once a day, as mentioned, either in the morning or at night, but always at the same time. Unlike other statins, atorvastatin is not dependent on nighttime timing because it has a long half-life. Can I take it with or without food? The answer is that you can take it with or without food. If it causes stomach upset, it's best to consume it with food. You shouldn't break or crush the tablet. People often believe that doing so will increase its effectiveness. Let me tell you, this is completely false. You should avoid taking atorvastatin with grapefruit, pomelo, or orange juice, as grapefruit juice increases the concentration of atorvastatin in the blood, raising the risk of myopathy, which refers to muscle and abdominal damage. You should avoid it completely, or limit it to less than half a glass occasionally. If you forget a dose, should you take 2? The answer is no. Take it when you remember. If it's almost time for your next dose, skip the missed one. What healthy habits can I adopt while taking atorvastatin? Well, a diet low in saturated fat will help you reduce your LDL cholesterol levels more quickly. You should engage in regular physical activity and also constantly monitor your weight to ensure that your cholesterol levels are not rising. What are the interactions of atorvastatin with other drugs? The most important and high-risk interactions are with antibiotics such as clarithromycin and erythromycin, which can significantly increase atorvastatin levels, raising the risk of muscle damage. What about antifungals? Ketoconazole, hydroconazole, and fluconazole carry moderate risks. They will increase plasma levels and the risk of myopathy. What about antiretrovirals? For HIV, it has been verified that protease inhibitors such as ritonavir and lopinavir can elevate atorvastatin to dangerous levels. Sometimes another statin is recommended. There are also moderate interactions, such as with miodarone, another type of drug that, in combination with atorvastatin, increases the risk of muscle toxicity. Calcium channel blockers, such as diltiazem and verapamil, which are partial inhibitors, combined with torbate, can lead to higher levels of atorvastatin. What about anticoagulants? For example, guaifenesin can increase the anticoagulant effect. The INR should be strictly monitored when starting treatment, and this should be done by a primary care physician and a specialist. What about alcohol? Are there any effects when combining atorvastatin with alcohol? The answer is yes. It will increase the risk of liver damage. So, pay close attention to this point. We also have minor or controlled interactions, such as in people with diabetes who are taking metformin. If you combine metformin with atorvastatin, there are no dangerous interactions. The same applies to omeprazole, analgesics, and vitamins. There will be no significant interaction. This information is very important so you know the potential interactions with other medications if you are taking atorvastatin. In conclusion, we must mention that atorvastatin is a potent and widely studied drug for reducing levels of bad cholesterol, which refers to LDL. It will prevent cardiovascular events, and let me tell you, it also has side effects and small signs that the metabolic risk factors may arise, such as diabetes. Well, with this part of the video, we've reached the end. Now that you know more about the interaction and effects of atorvastatin on the body, always take it with extreme caution. This is recommended by the entire Sibtaj team. I invite you to subscribe to the page and get ready to receive other engaging and interactive videos about the medications we'll be discussing later. If you enjoyed the video, please like it, and remember that you should never self-medicate with any medication. My name is Dr. Taj. See you next time. We are the Sibtaj Project.